Let me ask every nurse, case manager, doctor, and a social worker one question. Have you ever known a patient that might benefit from hospice, but you waited to bring up the conversation because you were afraid someone would think you were giving up? If the answer is yes, you are not alone. These conversations are some of the hardest conversations in healthcare. Today, let's talk about when it is time to start the conversation. Hi, my name is Rupal, and this episode ties right into our last episode, where we talked about why healthcare professionals often hesitate to bring up hospice. Today, I want to walk through the 5 questions I ask myself when I'm wondering if it is time to have that conversation. Question 1. Is your patient comfortable right now, wherever they are? Question 2. For patients in the hospital, once they move from IV medications to oral medications, from a higher strength to lower strength, will they stay comfortable once they are home? If not, do you have a plan in place? Question 3. Is this patient a frequent flyer? Meaning, are they coming back to the emergency room again and again for a symptom management, not because anything is curing their chronic illness? Question 4. Is the family burning out? Do they have enough resources and support at home? Question 5. Are you afraid that bringing up hospice with the patient, the family, or the doctor is going to upset them because they will think you're giving up? If your answer to most is yes, you are on the right track. This patient's health isn't improving. Their prognosis may be 6 months or less. They may qualify for hospice care. Nurses, you are the backbone of this health industry. Don't forget the power you hold in advocating for your patients. You know your patient and their family better than anyone else on that hospital floor. If your patient seems tired of repeat hospital visits, if treatments aren't working anymore, and every hospitalization is a setback, not a step forward, ask them what their long-term goals are. Encourage them to talk about their wishes with their family. Families are often in the same mindset. They just can't express it. Sometimes, patients want to keep fighting for the sake of their spouse or their children. And sometimes, it is the other way around. The families want to support the patient as long as they are able to fight. Eventually, both sides end up with a poor quality of life, with no improvement in health. So many unspoken moments passes, and it exhausts everyone involved in that patient's care. Knowing that treatment at this point is no longer helping, that's hurting them, not helping them. My fellow healthcare workers, nurses, case managers, social workers, please make this end-of-life journey as comfortable as possible for patients and their families. Send them home ahead of time so that they can enjoy their last few months with their loved ones with joy and peace. Your conversation might be the key that unlocks those meaningful moments at home. Remind the doctor about the hospice care available in patient's area. Care that can prevent frequent hospital visits for symptom management. If the family seems open to what you're saying, encourage the patient and family to bring it up with the doctor. Doctors will respect their patients' and families' wishes. A lot of doctors aren't open to palliative or hospice conversations, and they can get irritated. That's real, but don't give up. It's okay to tell the doctor he or she is doing everything in their power to make the patient feel better. But this is the patient's and family's wish to stop fighting a fight they can't win. The patient just wants to go home to die with comfort and dignity, surrounded by the people they love. The hospice team can provide ongoing support and help fulfill those wishes. There is no harm in having a consult. It can improve quality of life at home. the end of quality of life at home. This isn't a competition. Who can take care of the patient better? The hospital, the nursing home, home health, or hospice? Everyone has to team up here with one collective goal: improve the patient's quality of life and reduce family burnout. That's it. In our next episode, I want to talk about hurdles of being eligible for hospice care, what families can ask, and how to answer to make sure their loved one gets the right care. If this episode helped you, please share it with another nurse, physician, social worker, case manager, or therapist who might benefit from hearing it. And if you haven't already subscribed, please do. I post every week. I'm Rupal, and I will see you next week.